begin by educating Mr. Jones on what hypertension is. I know that he said he's been diagnosed with hypertension in the past, about 5 years ago, but sometimes people won't educate them completely on what that exactly means. So I'd let him know that hypertension is the prolonged period of high blood pressure, which happens in about 45% of adults around the world. So it's very common, but it's also a very dangerous disease, and it's very important that you understand what that disease entails and how important it is to take care of it appropriately. It is the leading cause of cardiovascular disease, and that's stroke, heart attack. A lot of mortality comes from having hypertension that's unresolved, and it's a lot more common in men. There's a lot of pathophysiology behind why your body can create a higher blood pressure. Sometimes your heart rate increases, your blood vessels can constrict, and all those things cause your blood pressure to raise. There are 3 different kind of types of hypertension, or I guess causes. The primary cause of hypertension is what I would diagnose Mr. Jones with. This is when there's not a real underlying factor that causes the hypertension. It is the most common. It's not caused by a kidney disease or something like that. It's just he has hypertension. Usually it's from modifiable risk factors and genetics and things like that. Secondary hypertension is usually caused from a second, there's an original source that causes the secondary. It happens a lot in younger people. It's not as common. It only happens in about 5% of people. It's a lot harder to diagnose, and usually the blood pressure readings are a lot higher than that of just normal primary hypertension. When this comes along, it's really important to treat the main cause of the hypertension first. So if it was renal disease or adrenal disorders, those things need to be treated first. Sometimes obstructive sleep apnea and endocrine disorders can cause the secondary hypertension as well. So it just would be kind of testing the patient and figuring out what could have caused those. It doesn't seem like that's the case here. With Mr. Jones, he has stated that he had a lot of history and a lot of reasons why he would have primary hypertension. And then complicated hypertension, which is something that Mr. Jones is probably starting to get lean towards, is where you've had such a long period so you have the prolonged hypertension that's not treated or not treated appropriately, and it ends up causing other organ damage. A lot of this you'll see in the arteries and of the heart and of the rest of the body, as well as the eyes and the kidneys. You'll see some vision loss. Sometimes people get kidney disease from it. You see strokes, heart attacks, all those things that the cardiovascular disease causes. That's when complicated hypertension is considered, is when you're seeing secondary effects from the prolonged untreated hypertension. So as far as Mr. Jones, I would look through his history. He told me he was diagnosed 5 years ago, which is something that he's telling me. He doesn't diet, he doesn't exercise, he doesn't watch his sodium intake. He's gained 30 pounds. It's obvious that he isn't real aware of what could happen if he doesn't treat his blood pressure issues. So I would just make sure that he knows what complicated hypertension could cause and how fatal it really could be. He does still drink. He says he drinks every night. That's a risk factor. The increased sodium intake with not watching his diet, that's a risk factor. His parents both having hypertension, that is an extreme risk factor. Hypertension is very hereditary. It runs through the genetics. He also, he's young, age can play a factor, so that tells you it could be very genetic, and also just his modifiable risk factors, like his weight, his physical activity that he says he doesn't really get much of outside of work, and then dietary changes and things. The biggest pathological effect of sustained high blood pressure that I noticed with reading his history is heart failure. I think he's already heading towards that direction anyway with his 20-pound weight gain over the past year and his shortness of breath. This is something I would really encourage him to take serious. Heart failure comes along with, it can cause a lot of other organ damage. And when you get to that point, it does show that you're really just not taking care of your hypertension. Heart failure is just the improper emptying and filling of the heart, and which causes poor perfusion, and it can cause the backloading of blood, which can cause pulmonary congestion and edema, which of course causes the shortness of breath and the weight gain. So I would just let him know, with proper treatment of your high blood pressure, like with antihypertensives and things, we are able to, if not prevent heart failure from happening, we're at least able to slow the progression, and just kind of explain to him how serious that is. Heart failure is not something that he wants to deal with, especially not at a young age. So I would explain to him that he needs to get focused on having more physical activity and losing some weight, decreases sodium intake, increases potassium intake. Those are all really important dietary factors. Obviously, you want to eat more vegetables, more fruits. You don't want to eat a lot of red meat. Don't want to eat a lot of saturated fats. Do low-fat dairy products. Not a lot of sweets. Obviously, act like you're on a diet, like you're trying to lose weight. Those are things that I would encourage him. I would also encourage him to just drink alcohol in moderation. It's not good to be drinking it every night. It's very high in sodium. That's not going to help his blood pressure. These are just a whole lot of things that he could follow that would really help to get control of his blood pressure and hopefully prevent heart failure. Obviously, we'd want to go ahead and look into it with the symptoms he's having, make sure that we have gotten an echo, that his EF is within normal limits, that he doesn't have some left ventricular heart failure with a sustained EF. So those are things that we would want to go ahead and get treated. That way he's on the right medication for that. And if not, we want to make sure that he knows that he needs to be watching his weight and his blood pressure at home. That way we know that we are giving him proper treatment and that everything's working the way that it should. So all these things, if we educate him on these, it really, really improves his risk for, a healthy lifestyle. High blood pressure, especially untreated, is very fatal, and it causes a lot of other problems, and he's young and really should know the gist of what this could cause for his life. I think if he was educated on these things, that he would make some lifestyle changes and it would really benefit him in the long run.